Unbelievable. He said couldn't get shut out.
Roll call, please.
Dale Schleter.
Yep.
Reed Schumann.
Yes, ma'am.
Dale Olson. Chuck Bennett. That's online. Don Pettit.
Yes.
Lorraine Boucher. Jennifer Babornik. Carol Pearson. Yes. Dr. Sabrina Dunlap. Present. You have a quorum.
Okay. Certification of compliance to the open meeting laws.
The meeting has been noticed to the public and news media as required by section 19.84 of the Wisconsin statutes.
Thank you. Meeting agenda. Has had a chance to look at it.
Motion to approve.
Carol, second. You. All in favor, say aye.
Aye.
Public comments. We have any members online anywhere? Is Tom online? Does he want to? Tom Jewell, does he wish to participate?
Yeah, Tom, if you want to talk, raise your hand on the Zoom. Alrighty, done.
Okay, Tom. Can he hear us?
You just have to unmute yourself. I can't unmute him from here, so.
Okay. If he unmutes, just let me know when I'm sneaking back in.
Yeah.
Comments. Now we do the public hearing on the Health and Human Services budget.
Minutes.
Did I do that? Oh, I did the
Oh,
agenda
that's-
approval. I'm sorry. Did I
That's
do
next.
that?
Oh, I'm sorry. You were correct. Public hearing first.
Do we have the budget or? Why is it signer, Tom? Just a placemaker or?
You have to have a public hearing.
This is just when the public comes in. And
Right.
tells us what they think. ought to
Yes.
happen.
Oh,
Like they do with the full county board, okay?
Mr. Chairman, do we have to go in and out of the public hearing by motion?
That would be good.
Yeah.
Oh, okay. Motion to go into public hearing.
I'll make that motion, Mr. Chairman, that we go into public hearing for the Health and Human Services 2022 budget.
Okay, second.
Second.
Thank you, Doctor. Everybody in favor, say aye.
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 Okay, we are now in the public hearing for the services budget. How long do we wait?
We've only got one member of the public online. I don't know if he's here for that or not.
You said you were here to listen to the public hearing on the budget?
Just to observe.
I'm sorry?
Just to observe.
Oh,
Is that okay?
do you- Yes, it is, of course. Do you wish to speak on the public hearing budget? Okay.
Thank you.
Tom, are you with us yet? Okay, motion to come out of Health and Human Services budget public hearing. Carol, second. Three, thank you. Everybody in favor, say aye.
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 Motion passed. Approval of minutes from previous meeting.
Motion to approve.
Motion to approve, Carol. You have a second?
Yep, I'll second that.
I'll second.
Okay, we got it in there first. Everybody in favor, say aye.
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 I gotta learn to wait for you online. Okay, number 8. Committee reports. LCO is not here. Is she online?
No, but Chuck has his hand up.
Oh, go ahead, Chuck.
Hey, I don't know what's different this time because we do this all the time, but I don't have, my camera's on, but I'm not seeing any kind of video. And I don't know if I've done something or something's going on. I just want to let you know I'm here, but I don't have anything else.
Okay, Chuck, I knew you were here. I just didn't know you couldn't see us. All right. Senior Resource Center. She did Joyce have a report?
No report.
Sorry,
No report.
okay, that's why I didn't see one. Hmm. 9, administration, Tom? Or Paul?
There's nothing under administration, nothing.
Hmm?
There's nothing under administration.
Okay. Adult long-term care.
You have a report there for your review.
Would you care to comment on that, Paul, or is it all any major concerns?
Oh, she just highlighted the system down for doing vaccinations for homebound seniors.
And then what is this looking so funny?
Agenda. Would you normally have the agenda?
Behavioral health.
You have 2 reports under behavioral health. One is from Alicia, and the other one is, second one is a placement update from Joe.
We have those. Any comments or questions?
Yeah, under behavioral health, Tom, maybe you can answer this. The new drug court that Justice Boyne is trying to organize, will behavioral health play a role in that as they did in the past, or?
I would think so. It hasn't been determined yet exactly how that's going to be set up. I think as we go through a couple processes we have going on right now. One is obviously the courthouse addition and creating space for the activities that we'll have coming up. Will play a part in that. Chris Channing, the district administrator, is involved in that process as well. And also the TAD grant that Justice Point is helping to write will hopefully create some of the funding that can be used for the drug court. And so the participants, I think, are yet to be determined, and how that, who the players are in that. So that's still to be determined.
Thank
Any
you.
other comments for behavioral health report? Mental.
Yeah, then you should have the summary of Cindy puts together every month now about the mental health placement cost per client in the facilities. And at the rate we're going, I think if you look at, see you guys in red, if it stays on this pace, it'd be just under 1.6 million.
And what, Patty, what did we budget for this for 21? For all the county placements?
All that up. For Winnebago and Mendota, we budgeted $600,000. For residential care, we budgeted $250,000. So that's $850,000.
So then that's about half then, huh? A little more than half. If this is projected 1.58, right, in red? What do you think we're gonna put in the 22 budget
Well,
for
you'll
a
see that in a
placeholder? Oh, see that in a minute? Okay,
minute. You're gonna see that soon.
okay.
Any other questions, comments?
Excuse me, I'm sorry. I have a question. There's only one report in here. Is there something from Alicia?
Yeah, there should be 2 reports under that.
AOJ.
There's a real short one by Joe,
Yeah.
and then Alicia has one that's usually a little longer. Is it-
I don't see that either.
Yeah, I don't have that.
I only see the first one from Joe and then the mental health costs. We just looked at.
There's a number 2, but there's no number 1 online. So I think we're missing the report.
There we are. That would be my fault. I can email that to everybody.
Okay, yeah. Great.
Thank you for mentioning that, Doctor. Protective services, substitute care. Okay, these are in front of us.
Yeah, you've got, hopefully those are attached to this. You have the substitute care report we're giving you every month. And then the caseload report from Carla.
Any questions, concerns, comments?
Trying to keep up with you, Chairman.
Tweet, I don't know if you talked to Tavism, but the RCC costs are on pace as they were last year for those. Same, some of them been in it for 2 or 3 years. So I don't.
Paul, does insurance pay any part of residential care for these kids, or is it all out of county?
No. There's
No.
no insurance.
No insurance.
Ms. Pettit, did you get it?
Don, go ahead.
Yeah, I'd like to ask a question. I see that there's totals for the Health and Human Services. I'm looking at the foster care and things that says total for, Sawyer County Health and Human Services. And then there's a total for the LCO. Are we paying the full amount and the tribe is reimbursing the county? Or are we just paying for it out and no reimbursement from the tribe?
Patty wants
Go ahead, Patty.
The Sawyer County pays for all of it. The tribe is just designated on there so that we could show who are placed by the tribal child protective services. But Sawyer County is responsible for payment on all children in out-of-home placement.
That's because we,
I guess my question would be then for Mr. Schuman. I thought that there was going to be something where that the LCO tribal government was, is there not health insurance for some of these individuals that would cover some of this through the tribe?
Yep, we have health insurance, but the insurance doesn't pay for these costs. Correct, Patty?
Health insurance doesn't cover out-of-home placement costs. That's like room and board and supervision.
Okay. So with the CARES Act money this year, is there no way that there's any money funded for that through the CARES Act to reimburse the county?
I don't think it's COVID related. Isn't the CARES Act specifically COVID related? It's just.
There's housing.
Yeah, and this year's money is called the rescue money, and it's got to be COVID or pandemic related. Housing is a part of it, but that's due to COVID.
Well, if the contentions were by some of these, I remember going through that, that was one of the reasons some of the members believed that the numbers were up because due to COVID, that some of these people were in the situation they were in. So is that not the case anymore?
Patty?
I don't believe that children wouldn't be in out-of-home placement because of COVID. What might have happened is that you couldn't step them down. Maybe they were in an and I'm speculating here, but maybe they were in an RCC or a group home and you couldn't move them to foster care or to a lesser placement because there was no moving. They could have gone home to their family if that was appropriate, but they wouldn't have been able to go to a lesser out-of-home care situation because of COVID. But COVID would have had no reason as to why they were in foster care to begin with.
You know, foster care, you're talking about RCCs.
Anything. I'm talking about any out-of-home placement.
Well,
We don't remove a kid because their family has COVID. None of that.
Well, I think that more of my would be, instead of the foster care, maybe I misspoke. It was the people that we had in Winnebago and some of those individuals. I remember that was.
That would be child. And no, that's got nothing to do with it either because they're still there.
Right, but that was a contention of some of the board members. Was it COVID related? That's why these people were being pushed to the limit. So I'm just trying to figure out, we have the county's taking on all of this responsibility and with the people that are in Winnebago and other facilities, I'm trying to figure out where if the tribal entity, they have insurance for this, why isn't that not picking up any of it either? It might not cover foster care, but placements and things like that. But what about for the mental facilities?
Winnebago is a state institution for mental disease. So they do not take, they will bill insurance if a person has insurance. And then Sawyer County gets billed above and beyond what the reasonable daily rate is. So even if someone has medical assistance, Sawyer County is still on the hook for a good like 60% of their bill. It doesn't, because Sawyer County is responsible for the full cost of care of anybody in the state mental institution, even if they've got medical assistance or insurance. So Winnebago does do a good job of going after anybody that has any funding source, and they do reimburse us that. Unfortunately for us, the people that are currently long-term there have exhausted all mental health benefits for the rest of their life.
and we don't have children that stay there for an extended period of time.
No,
If they go there, they're in and out right away.
yeah, no. It's adults that we have in the state mental institutions.
And where did we make any headway with the legislators when you spoke with them about possibly coming to the, going to the bat for us and not us having to carry this? That this is going to break small communities, small counties like ours?
Yeah, we did, Don. We met with them. Tom and I and Dale met with Senator Petrowski and Senator Bewley. They were very open and they understand our concerns and they actually listened to us. We talked about a couple ideas of maybe all the counties could pitch in an amount to cover this entire state facility and not leave it to single counties that have several people in there. So they were open to all those things, but they would have to bring it back to their legislature and there would have to be an amendment or a law change on how they fund that. So they did listen to us and we preach that every year. And other years, like Paul mentioned, with this residential care, that is a large difference between LCO and Sawyer County. So we did bring in our ICW director to Bissum, and she spoke to us regarding the care the LCO kids are receiving there. So I think we'll invite her back and look at this idea. That's a good idea, Paul. And just see if we can see where we're at with this.
Thank you, Mr. Schuman.
We're aware that we're all these people are in residential care, and are we monitoring them? Is it time? Do they have to be there?
You're in there like more than a year or so. That's a long time in one of those places. A couple of them been like 2 or 3 years, Patty. So
Yeah.
It's a long time.
I think it's time we invite Bissum back and just see where they're at.
Carol?
Sorry, I spoke out of turn. I thought there was a limit to the amount of time that a child could be in the placement. No? Oh, it can be extended now. That is too long.
Especially when they're in it at 10.
Do they ever get to be adopted out or something? Okay. Wow.
Okay, go ahead, Tom.
Here's what I don't know. We brought up when Bissum was here last time. When they're in a facility like that, there should be discussions going on, whatever organization placed them, and what's the plan about getting discharged to go to a lower level of care? Is there any work being done with the family? What's being done?
Right.
So 2 to 3 years, it's really mind-boggling that, and I don't know where, we did talk to Bissum about this a while back, and I think our response is we're doing everything we can. So I don't know how to, it's just, last year in that category, we spent roughly 660 and projected to go 620 this year, Patty. It keeps on pace. I think it's what you told me. So
Is it a matter of that there's more foster homes needed?
Excuse me?
Is there a matter, this is Ms. Pettit, is it a matter of there's more foster care homes needed for lower level care of coming out of the residential facilities? No child should ever be in one of those facilities 3 months tops. That is devastating to a child. If there is going to be no reunification with the family or a plan worked out with the family, these people that are placing, these individuals that are placing these children into these residential care homes should have to live a day in the life of a child there. As a parent, that's absolutely horrible to think some of these children have been there 2 or 3 years. And they lose all hope. I've come to terms with it many times, trying to decide if I should foster or not this exact reason. And I think maybe that's another push that we need to do within our county for foster homes. So we don't have a lot of these kids sitting in homes or other kids that are sitting, waiting to be fostered, and there's not enough homes for these children in our community.
Thank you, Don. Any other comments?
I was just going to answer Paul's question. In 2020, we spent $716,448 just on RCC. That's not foster group home. We're projected to spend in 21, $944,254.
is that combined? I was doing the,
That's
you do,
just RCC.
right, so you did, LCO and the county.
Yeah.
Right. I
Yes.
was looking at With the bigger, okay. But I was talking about that the LCO, the same LCO placements last year were 660.
Oh,
And I think you
don't-
said you projected to go to 620.
Gotcha, and I don't have that broken out in the budget by LCO and so.
Okay.
So if we ask to bring them back, are we going to speak about the reunification plan and the movement?
Well, yeah, what's the plan other than institutionalize them? Or what's the plan?
That's what I'd like to know.
I'm just, and who's overseeing that and making sure those things happen?
That's what I would like to know also. I'm sure that there's some parents that would, or relatives that would like to have their children moved out of those facilities. It has to be. But who makes the move and what is the plan?
I know with our places, we have contact with the providers and there's
Right.
constant communication. What's the plan? What's going on?
Right.
So they don't
They're reviewed all the
sit there.
time.
Yeah, what's going
Yeah.
on? Visits and and I don't know.
Okay.
And that's what we brought up last time. And I recall the business saying we're doing all that and doing everything we can. That's where they need to be. So I don't know.
Okay.
Okay,
Thank you.
thank you. Moving on to Technical
13.
Economic
13.
Economic supports.
You have a report from Shauna. For your review.
Questions or comments? Okay. Public health. COVID update.
Yeah, Julia is not here tonight, but she did submit a report. And she did add, which was emailed to me. There's nothing new with COVID since the update I sent, except that we were in the green for 3 days, but back in the yellow, but no real concerns.
Right. Include public health services board update.
Yeah, that's her report. That's what she called it, yeah.
Fiscal budget performance reports. Got those. Any concerns, comments?
Mr. Chairman, I guess if I could just go back, what I was gonna ask Doctor, is there any concerns about the variant strains that are out there with COVID, and where are we at with that? Because we keep hearing that keeps coming out from more.
Well, I think the assumption is that probably 25% that's already in, I don't know about the state particularly, but in the country, about 25% of our new cases are probably the variant. So far, the vaccines are all looking like they're protective. So mixed news. It's here.
But the people that are vaccinated seem to be protected.
Yeah.
So,
Yeah.
Good.
It's not as good, but it's very protective against the severe cases. So it's more worrisome for the pockets of people that are not vaccinated.
Does it seem to be like with children? Does it seem to be more vulnerable to kids where
I don't
COVID
know.
was?
I don't know the answer to that, but
Oh.
it is something I'm sure will be looked at in the fall as we go back to school.
purchase services recap. Okay. Then on to first draft. of the health insurance.
Yeah, so Patty will do the presentation, just a little background. Paul had his staff prepared budgets for each of their areas. We being myself as county administrator and Mike Keefe, the accounting manager, met with Paul and his staff to go over the preliminary budget. this is stamped draft at this point. This is just the first kick at the can here. And to see where we're at, because we're going to have a lot of discussions, as we always do, budget time, and I'll give you my whole woeful story as I do every year, but Patty will set the stage for the good news and the bad news.
So what you have in front of you are 16 pages of the pared down budget. It's the, so it is broken out by unit, by supervisor, basically, is how I break the budget out. For those of you that are new, let me just go through the process. It starts off with, I wait till at least 5 months are done through May and get the expenses and project out the expenses for the year. And Paul and I meet with each and every supervisor, go through the projections, where we're sitting, what the previous year's budget is, anything we need to take into consideration. Then I come up with a draft budget, this 16 pages, and we sit as unit supervisors and Paul and review it, and they do any tweaks to it that they want me to do. Then we invite Tom and Mike and present it to them, and then if they've got any tweaks they want me to do at that point in time before it comes to you, and then the next step is to present it here. The first page is all of the next pages rolled up into one. So this is the overview of the entire agency. On your left are your expenses by category, direct, administration, and the administration goes out to each and every grant. That's why it's in its own column. What 2022's total is, the 2021 budget, and the difference between the two. Below that, you're seeing how much county money we are requesting in 2022, how much we requested in 2021, and what the difference is. On the right is the revenue, the 2022 revenue by category. That is state grants, allocations, medical assistance, Medicare, which we do not bill any longer, client revenue, insurance, for a total. Then I give you 2021's revenue in those same categories, the difference between 2021 and 22. And then in the note section, it's just to alert you to anything that we took into account, any major differences between 21 and 22 of what you're looking at. So for this budget, we projected COVID revenue and expenses through May of 2022. Julie is expecting that we're going to be continuing to have COVID money and activity in the agency. We do hire additional staff into the agency for that, contact tracers. And so this budget does take that into account. It did not affect this budget because all I did was come up with the expenses, and then I said, we're getting that much revenue because we get as much as, you know, that's how much we would spend. So it didn't, bottom line, it's not affecting anything. We increased child welfare, RCC, and group home and foster administration by $388,729. We budgeted removal of OASIS on the revenue and expense side. And we increased juvenile justice group home costs by $10,000 just because we're getting rid of OASIS. But you'll see what that difference looks like. So the difference between, we are asking for, bottom line, $11,852 more than last year. Now, when I do this budget, this is how much county money we're asking for. I'm not differentiating where that money's coming from. Last year, a great portion of this came out of our fund balance, of which is gone. So I'm not saying, this is county money, whether it be levy, county fund balance, health and human service, you know, I'm not saying where it comes from, it's just that that's how much it is. Do you understand the difference? Okay. Because last year, our budget was made whole based upon our fund balance, and now it's gone. So.
Is it?
Mike is more than projecting that we're going to eat it up fast.
At the end of 21.
And probably the whole, if Cindy's projections are anything. So, The next page 2 is the administration expenses. There was nothing earth-shattering on this, hardly any changes. This, you're going to see this administration on each and every category, each and every page from here on out, because this $517,000 goes out to all of the other departments now from here on out. Okay. We budget for administration as well as indirect costs. The difference is the administration is what we pay internally for telephone, for people to man the desk, for Paul's salary, etc. Okay, it's our agency expenses. Indirect cost is what the county pays to have us here. We do not pay for that, but I claim it on the budget so that we can draw down federal dollars whenever possible. But then when I get back to the front page to tell you the bottom line, I have subtracted it back out so that I'm not claiming that we're spending it, but that I'm capturing as much money as we possibly can in any possibility. So that's page 2. Page 3, you're starting with long-term care. Again, it's the same format. You've got your expenses on the left, your revenue on the right. And you're seeing how much county allocation we are asking for in 2022, as well as how much 2021 was.
Patty, what is that difference? I can't see.
We are asking for 342, and in 2021 it was 304. If I go too fast, stop me. The page 4 is what you're going to see for each and every unit from here. This is the ADRC and Adult Protective Services unit, and what you have is, so purchase service is our biggest category. That's why you get this purchase service recap every month, because under long-term care, we've got $149,861 in purchase service. What is that? Here's your detail of what it is. And it also not only gives you the detail of what we're budgeting, but it gives you our expenses from 2011 to 2020, our projected 2021, are what we budgeted in 2021, and what we're budgeting in 2022. As you can see, we didn't change anything. We tweaked between lines, but the bottom line of this is the same.
You said you gave us numbers from 2011.
This is 2008. You're seeing this expense, the history.
Okay.
You're seeing the history from 2011 to 2020, and then the projected 21. Page 5 is AOD and mental health. Now we are, our county allocation is $1,245,181. In 21, it was $1,232,066. You can see on page 6 where this is. Last year, when we did the budget, we increased Winnebago and mental and Mendota, thank you, from 175,000 to 600,000. So our budget had already gone up substantially. We left it at 600. Now you can see that we're projecting 1.179, almost 1 million already. You can tell us what you want us to do. Yeah, I mean, so we're projecting that we're going to spend twice that, but we're budgeting 600. Children and family.
Patty?
Yes.
Just to highlight that, because that is one of the important pieces of this budget and the biggest problem area of the budget. You know, and the reason this says draft on it is because it's a problem that we still need to solve. You know, if we added another 600,000 to this budget, we need to take 600,000 out of somewhere else to make things balance. And it's not necessarily a health and human service problem, it's a county problem. You know, for the Health and Human Services Department to absorb another 600,000 or $1 million, you're going to have to cut another $1 million of their services, which many are mandated and at minimum levels to begin with. So it's hard to solve it just within this department alone. So as we talk at the county board level, it's kind of affects other departments as well, to cover these costs. As Patty said, we've increased our fund balance in this department over the last 6-7 years. Until last year, we had to use some, and this year we'll use the rest of it. And so that funding source to balance the budget will no longer be there to help us. So we do need to solve this problem in addition to other county-related problems. But this is the one that we'll be talking about a lot as we go forward. So sorry for the interruption.
That's
Please
okay.
continue.
And as long as we're still on page 6 here, this is probably where, when we give you the history back from 2011 through 2020, is probably the most telling and what you would look at the most. Because in 2019, we spent $250,000, and in 2020, we spent $1,243,000 in Winnebago and Mendota. And now we're projecting.
And it was lower in 19 because that one person had insurance, but it ran out, right?
Exactly.
It would have been like that, yeah.
They had Blue Cross Blue Shield, and now they're
Capped.
it's capped for their life. So page 7, children and family. Here's you're going to see a very large increase. We are projecting county allocation of $1,422,000, and I'm rounding here, guys. In 21, it was $1,053,000. And of course, that is from what I had on page 1. On page 8, you can see that we are increasing our RCC, our foster, and our foster administration. So foster administration is, the categories of care when you put a child in out-of-home placement are kinship care, foster care, therapeutic foster care, which has an administrative rate with it because it's usually it always is with a company that does therapeutic foster care. Group home, RCC, okay? That's the levels. You may say, okay, well, we're only projecting $944,254. Why are we putting in $962 in the budget? That's because the projections were based on 5 divided by 5 multiplied by 12, and we put in more kids since then. So we talk through with each supervisor as we're going along. What are we thinking? What's the pace? How are we doing things? And that's why these figures were arrived at. So you're seeing that this increased $384,729. Juvenile justice is page 9. Here's you're going to see a dramatic decrease. County allocation $239,731. In 2021, it was $564,471. Again, we took out OASIS, revenue and expenses out of this. So again, this is the draft. I know that hasn't been a decision, but when I was told to do the budget, I was asked to budget that way. Unpaid. Yep.
So Patty, you're saying then that the difference of 30,000 is waste?
If I were to have to put in the budget what we're currently spending on OASIS, it'd be a lot more than that, because we're covering pretty much almost 6 empty bed days. Most months we only have 2 children in there, and we have to pay for 6 no matter how many are there. And there's only one Sawyer County resident, and has been for quite some time.
Okay.
And we're.
So are you adding that difference then to out of county placement? Because without OASIS, we'll have to be keeping 1 or 2 out of county somewhere and paying for it?
It was the 10, that was the $10,000.
Okay. That's what $10,000 was. We increased by 10,000.
Okay.
Into group home, and then we.
Is that 1 out of county?
That's all we had in there.
Oh, okay.
We've only had 1 juvenile.
Sure. And that would cost us 10,000 placed out of county.
According to
Around.
Brittany, that's.
Okay.
That's what she asked me to increase, because we already had, we already had 10,000 in group home, so we just increased it to 20. That's for group homes. So the second, there's foster care, group home, and RCC on page 10, the first 3 lines. Those are non-OASIS. As you go down, you'll see OASIS group home. Because there was always going to be possibly a child that didn't fit to OASIS that may be a juvenile. So we always had to have some money in the budget for when that happened. So all we did was increase it from 10 to 20 on that, and that should cover them. Also note on this that the building is still there, and it has, as I had told Tom and Mike, somebody's got to pick up the expenses of it then. So we, right now, half of the building is being rented out to Northwest Journey. They have a day service program in there. Whether they would stay on, possible, but I don't know what the plans for that building would be if Oasis is not there. But somebody does have to pay for heat and light and the payment in lieu of taxes and all that kind of stuff. So, I mean, although it's not put in my budget, it still is a county expense, which I didn't.
Unless we were to sell
Well, whatever you do with it, yeah. And then we could take that money back and put it on.
Right.
Put it in as
Or-
courthouse expense.
Yeah, I mean, so I don't. Economic support, page 11. This pretty much stayed status quo. The reason that it went down, you'll see our current, is because we have new employees. Page 12, you'll see that it was just a slight difference in that. That's because of the contract. We are part of the consortium for economic support, and they contract with CSI for fraud investigations, and it's offset by contract, so it didn't affect the bottom line, even though the purchase service increased a bit. The last one is public health, and again, when I say that this is a roll up of these, each one of these pages is a roll up of every grant they have. So this page of public health has 16 grants underneath it that are totaled up to these totals. So, and each one of these pages have many, many grants totaled up to them. So that's, and then the front one is all of these pages totaled together. So that's public health. You can see county money 376 in 2022, 364 in 21. Again, COVID had no impact on this whatsoever. I made it come out budget neutral. The purchase services for purchase service remain constant. The last one is sanitarian/water program. There's $12,166 county money in there projected. In 2021, there was $11,592 county money. And this basically did not change. Any questions?
Hey, do we know if they did have Wisconsin accepted Medicaid expansion, how that would change those numbers?
I have no idea.
Yeah, so in conclusion, then, this, as I said, was the first draft that we've seen. The other departments are putting together their operational budgets as well. And so those will be coming to us through July here. And then once we compile the whole county budget, then we've got more work to do and seeing how much we need to trim from different areas and whatnot. So we'll be discussing the budget every month between now and the budget adoption in November. So a lot of work to do yet. So this is the first crack.
Mr. Chairman, I got a question. So
Oh,
Tom, where,
Tweet right behind.
oh, I'm sorry.
You didn't see me, okay. I just have a question for Paul or Patty. All the mandated services that we have to provide through Sawyer County, are there any increases at all from the state or the feds because those are mandated services? No, nothing.
They haven't increased in years.
Some of them decreased.
Yeah.
What really happens to us is sometimes they, I have to say, one good thing though, is that the state did, and the 2022 budget will reflect, it is reflecting this. Children's long-term support. The state took on the waiting list. And once again, they drew a line in the sand and they said that as of this year, you owe Sawyer County, you owe this amount forever to us, which they've done, and they periodically do with different programs, such as in the long-term care, you're going to see that we have a payment due to the state every year for our old long-term care program. Sawyer County has to pay that in perpetuity. The economic support also has a maintenance of effort that we have to, a minimum that we have to spend. They did that with children's long-term support, but the good thing is that they are picking up 100% of the costs after that. And the only reason that we are even as high as we are with our maintenance of effort is because sometimes you get children in children's long-term support that are outlier children and are very, very expensive. And we had that the year that they drew the line in the sand. But as we are increasing the number of children going on this, it has gone from 9 to 44 in the last 3 years.
And then this sounds like it could be a model for adults. Long-term care and
But that is a good thing for us, even though we have to pay out that same amount every year. I think ultimately, hey, I'm looking at it as a big old bonus because we really were scratching the ground the year that we, have, and it keeps popping up now that we have children with, exceptional needs.
I'll make a comment. You talk about Winnebago. I meant to say this earlier. When we talk about those Winnebago placement costs, keep in mind when you're talking to legislators, whoever you're talking to, it's not just Winnebago. It's when you get out of Winnebago, these people have these high-end needs and they need to be placed somewhere. So those are the costs we're talking about too. So it's not just like the person that's in Winnebago that's been in there for like a year or two. They have to go somewhere, and the only places available right now are going to cost more than Winnebago.
Oh.
And so it's not just the Winnebago cost. The issue with Winnebago is they don't want to keep these people here very long. They want us to place them. So, and there's a huge cost to that as well. So I just want you to keep that in mind. It's not just Winnebago. It's the long-term placements for those individuals as well.
That was the place that Joe was talking about when we were talking to the senators. What was the name of that? They had like 5 staff per person.
Right. Well, that's what some of the recommendations for some of our individuals that have that many people, then the costs go up. And it's just extraordinary.
There was one particular
Right.
place that you mentioned. It was just 5 staff, 24/7 per person.
It depends on the person, and then the facility, if they agree, then they'll have to hire that many staff. And we had one at one point, I think it was up to 3 to 1. It just didn't work out. It's
The person that's in Winnebago now, long-term, was in a residential facility with 2 people with her 24 hours a day, and it still wasn't enough. So
Okay, any further comments, questions?
I do, Mr. Chairman. So Patty, we'll be over budget on our out of county placement from what we budgeted. And you said the fund balance is,
It'll be gone this year. I mean, I think Mike, when I met with him, he said there was $25,000 left. That's,
so how will we balance? Or how will we finish 21 then? Sure. Oh,
Oh, that's what we,
Bake sale?
I don't know. Where did the money come from when it's mandated, sir? I don't know. I guess
well, we
that's
had a fund
really,
balance, so. Or
but how long does that last?
Well, I know.
I don't know what the answer is. Tom, what's the answer?
so,
That's a magic question, with no answer.
There really is no answer because there's no cure for this. There's no cure for addictions. There's no other addicted. There's no other mentally ill. There is no answer. Just do the best we can. What we have. Okay, is that it for the budget?
Nice presentation, thank you.
Okay, youth justice. Need to move to closed session.
Number 16. is in there.
Oh, I'm sorry. 60. ARPA.
So if I may, the American Recovery Act funds that the county received, 3.2 million roughly in funds between this year and next year. So we received half of that already. So we've got 1.6 million currently in the bank, and we'll receive the other half of that next summer as well. We do have until the end of 24 to expend those funds or to commit those funds, and they have to be totally expended by the end of 26. So there is time to determine the uses of these funds. Obviously, some things may be urgent and we want to get moving on those immediately, but some are longer term, such as the broadband infrastructure that we can build. It's going to be a problem for many years, and we've got a couple of projects that were approved at county board last year, at least to apply for funds to help augment that project. So at county board level, we talked about the eligible uses of these funds. There were 6 broad categories of things that counties can spend this money on. The good thing is that these funds were allocated directly to the county. And so we do have the opportunity to decide what our priorities are and to use those funds that can help those needs in our county specifically. So, the broad categories, in addition to the broadband infrastructure or water and sewer infrastructure, replace public service revenue, loss, premium pay for essential workers, address negative economic impacts, and support public health response. So again, because of these funds being available for remediation and help with the COVID-19 mitigation efforts, some of these expenses that we incur for medical expenses, behavioral health care, and certain public health and safety staff could be eligible expenses. Now that's a very one-sentencey thing out of a 150-page document that tells you exactly what you can do. So some of the things that we talked about earlier, could they qualify? Perhaps. It says on this sheet, behavioral health care. Well, what exactly does that mean? Well, the devil is in the details when we read the interim final rules, which will become final rules within the next month here. We have to determine what kind of costs are truly eligible for these funds. even if some of those things were eligible, is it the smartest way to use those funds? These are one-time funds. You know, we use it and they're gone. So to fill an operational gap with one-time funds doesn't get us anywhere. So we have to be careful in that respect. But each of Paul's staff is aware of this. They have organizations that they talk amongst their peers as well. And so we've asked, staff to bring their ideas forward as well. And then if this body also has ideas on things that you would want explored, we can certainly do that as well. So we've put this topic on each of the committee's agendas throughout the county as an opportunity to kind of discuss this and bring forth ideas on how to use these funds. So
Have we allocated any of the funds yet of our 1.6?
we did last month at the county board with the broadband, about 500,000 was allocated to 2 different projects within the county. And those are applications to the PSC to receive some funding from the state. And so the funding that we provided is just a portion of those projects that are also funded by the service providers, Norvado and Mosaic, thank you. Chip in some money, we chip in some money, the towns that are affected chipped in a little bit of money. And so then if we receive the PSC grants, those projects would go forward and we would expend those funds. So that's the only thing we have allocated, potentially allocated thus far.
Tom, you said that in a month you'll know the fine details, correct?
We basically know the fine details now. They're still called interim rules at the federal level. So at the federal level, they put out these interim rules, and now they're in the comment period where they accept comments like, what does this mean? What does that mean, for clarification? And then they'll come back with the final rules. But basically, we generally know the categories and the things that are allowable. But the fine line is you don't want to spend money on something that you may have to pay back because
That's
it
what I
ended up
was
not
worried
being.
about,
Right.
because the way it's worded.
Yeah, and so the more firm we are in knowing that some of these things are eligible, like broadband, even broadband has to have certain qualifications. It has to be still, speed at such a level, and it has to be in unserved or underserved areas. So even though it says you can spend it on broadband, well, if this and if that and if this.
So it is specific then?
Yes.
Okay, thank you.
Anybody online have any comments? Anybody else? If anybody comes up with a magic solution, say how it's recommended. Okay, thank you very much. Now we can move on to youth justice.
Closed session.
This is a closed session.
Nice to meet you, Patty. Step down, Paul, and Katie, say hi.
I'll make a motion, we go in a closed session,
Second it.
Northwest Oasis Group Home pursuant to Wisconsin Statute S 19.851E for the purposes of deliberating or negotiating the purchasing of public properties, the investing of public funds, or conducting other specified public business.
We have a motion by Tweed and a second by Don. All in favor, say aye.
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 Motion passed. We are in closed session. Future.
I know. Right.
Okay, 18 future agenda items.
First, I would just like to invite Tabissa and LCO ICW to our next meeting to kind of explain their RCC costs and how we're monitoring those.
Will you be asking the questions
Sure.
to tweet? Okay, to Bissell, okay.
Also ICW.
director, Tibissum Rice.
She is the director of ICW.
Yes.
Okay, and you'll have some pertinent questions on this, okay?
Oh, sure.
The time frame and
Yeah,
the follow.
Will you invite her?
I will.
Okay, good.
Remind me.
I don't want it to get arbitrary.
Oh, no,
I
no,
think that
no.
it should be done with law.
And maybe we could have Carly here too.
Yeah.
Oh, yeah, I'll talk to her.
Any other suggestions? Any reports from conferences?
Just correspondence wise, I don't know if you saw the Sawyer County Record, but there was a large article on mental health issues that Frank Dufall had. There's actually a couple articles. Frank did talk to our staff and staff of other counties and put together some helpful information for the public to help understand some of the strife we're going through in that regard. So very educational for the public.
Have you had much feedback?
I haven't. Did you, Paul? Have you?
No, no.
Nobody got feedback?
I had one individual in my district ask me about it. That was it.
Yeah, I'm glad he did it. It is helpful. You know, we talk about public involvement in the budget process and everything else. It's like, okay, well, they don't know what our problems are, and that I think is helpful to get people to understand.
I think if he can do a follow-up or maybe, every other week or something, it would be educational to the public. And I think the fact that the resources are so limited in the mental health area in your rural communities, they have to realize there's nothing available. No, I'm not nothing. There are things available, but I know that some of our therapists are 2 or 3 months out for an appointment. A crisis situation, you know what that is, Joe and Alicia and Paul. I think those facts need to come out so that the public understands the pressure point and what is going on and the cost incurred when you have a crisis situation.
I could attest to that if you wanted to get into the county dentist at North Lakes, or you will be sitting, if you are not a current patient and you are a new patient, you'll be waiting over 1.5 years.
A year and a
Because, yep, to get a cleaning or, yep. So if you are already in a situation with no job and you are sitting on, relying on Badger Care, and you are living in Sawyer County and you want to go to North Lakes, you will not be able to get in as a new patient because there's only one dentist. My daughter is a patient. We have other friends that needed their children to go there and have not been able to get an appointment because they're still trying to play catch up from COVID when it was all shut down. So it's been 1.5 years. So if you can't get in to get a cleaning or x-rays, that's what we're faced with in our community.
If there's no further discussion, meeting's adjourned.
Thank you.
Thank you.